These are the faces of those most likely to die from malaria. For every minute that goes by, a child under the age of 5 dies from malaria. Malaria has been diagnosed on every continent, but sub-Saharan Africa is the region most afflicted. Dr. Anthony Fauci, who heads malaria research at the U.S. National Institutes of Health, calls the parasitic disease one of the world's worst killers.
We've made substantial progress in a global community way with malaria because there are several countries that predict that by 2015 they will have substantially, by more than 50%, up to 75% decreased the incidence of malaria. Having said that, as the good news, the sobering news is that we still have 660,000 deaths per year from malaria.
Multiple strategies have been used to fight malaria. Bed nets treated with insecticide protect against mosquito bites. Those infected are treated with drugs early before their disease turns deadly. Pesticides are sprayed to control mosquito populations. Several researchers, including those at Johns Hopkins School of Public Health in Baltimore, are trying to change the mosquito that transmits the parasite that causes malaria. The director of the malaria research program at Johns Hopkins, Dr. Peter Augie, spoke to VOA by Skype.
We could stop this and we could control the mosquitoes by either eliminating them, which is very difficult to do, or treating them to make them less effective to carry the infection.
Dr. Augie says Johns Hopkins has had great success with the mosquito treatment strategy in Zambia, where its researchers are working with an established hospital.
The burden of the disease has been knocked down by 98% in a decade. So we've gone from a region with 1,500 children being admitted to the hospital each year to a couple dozen.
But the success of the global anti-malaria campaign could also be its weakness, according to Dr. Fauci.
My concern about even saying there's good progress is that we have been here before, not only with malaria but with other diseases. When you start to see a downtick in things, people say, well, we have the process or the disease under control, we can move on to emphasizing other things, which would be a really bad mistake.
Dr. Fauci notes there is no vaccine yet against malaria. Mosquitoes that transmit it are becoming resistant to pesticides, and in some places, the malaria parasite is becoming resistant to the drug that treats it. Complacency and cuts in funding could allow malaria to reestablish itself in areas where it has been reduced or eliminated. And the human stakes are still high. In the time it has taken for this report, 3 more children have died from malaria. Carol Pearson, VOA News.